Hi, Dr. Chang. Thank you so much for sharing your time with us today. Could you please tell us who you are and the extent of your involvement with vaccine education?
Sure. My name is Dr. Shanti Chang, and I am a doctorally prepared nurse practitioner. I currently serve as a professor at George Mason University and am the MSN Division Director for the Family Nurse Practitioner Program. I've been with Immunize VA since its early days and have served on the steering committee for nearly 5 years now.
Yeah, we've been so lucky to have you this whole time. Um, and so we're here today to talk about the fall respiratory season and specifically how we can help healthcare providers to prepare for the fall and winter seasons. So one of these ways we can help prepare is by addressing common questions or concerns that patients might present on flu, COVID, or RSV vaccines. So I was hoping you could share any personal tips that you might have.
Yeah, absolutely. I think oftentimes people rely on personal experiences more than technical explanations. For example, something that comes to mind is a student who once told me that their father got the flu from the flu vaccine. So in that situation, I used open-ended questions to try to understand their perspective. I have found that the most important thing in the field of medicine is being able to communicate with empathy and compassion, and having that honesty and openness helps develop trust.
Definitely. Yeah. And another myth I've heard is that the flu shot doesn't work. Do you have any helpful responses that providers can use if they hear this?
Certainly. What I like to say much of the time is the flu shot will prevent the flu. However, it also reduces hospitalizations and deaths in people at risk for influenza complications. For example, the flu vaccine is protective against heart attack for those who have chronic conditions. And my favorite fact is that the flu vaccine can prevent heart attacks in people with heart disease just as effectively as quitting smoking or taking statins. Also, for those who say they're worried about the truly low risk of Guillain-Barré from the flu vaccine, you are 8 times more likely to get Guillain-Barré from the flu itself. So I think that's impactful. The last thing I like to remind people who say, I never get the flu, is that by incorporating community health and considering family members' health who may be more susceptible than you are, we can all pitch in to ensure that we stay protected as a society.
Yeah, those are all really interesting and helpful. Thanks for sharing those. And I'm especially going to use that example of the smoking one. I think in public health, we talk so much about smoking cessation, and so that could be definitely something to tie in with vaccination.
Absolutely.
Um, yeah. And are there any other immunization pearls, so to speak, that you would like to share with providers?
I think I can think of two off the top of my head. I think it's really important as healthcare providers, first and foremost, to frame the flu shot as a standard part of care. So using language such as "I strongly recommend the flu vaccine for this year" carry a significant weight with the folks that trust us in healthcare. I also think about. I also encourage people to think about ways that they can involve and train the entire team to advocate for the flu vaccine, and that really creates a culture where flu immunization is a team effort. So maybe that means asking staff at the front desk to, either look at the chart or remind people it's available, or simplifying access by providing it during their regular appointments or offering additional walk-in clinics.
Yeah, definitely. I think that's such a good perspective to really incorporate all members of the staff as part of the vaccination team. Yeah. Great. Well, thank you so much for your really thoughtful answers to these questions. If healthcare providers have any further questions, I'd like to encourage them to visit our healthcare provider resource page online at immunizevirginia.org. We also have a new resource that we've uploaded there called the ACIP Snapshot, and that will provide an overview of the most recent recommendations from CDC and the Advisory Council on Immunization Practices. So thank you so much again, Dr. Chang, and we're so glad to have you as part of the Virginia Immunization Coalition.
Thanks, Belle. Happy to be here. Thank you.